because I've been in the NHS for many years now, and to be quite honest, I've never really actively participated in taking up the opportunity of the flu jab. We have many things offered to us in the health service, and flu jab being one of those, but I've never taken it up in the past. Mainly because I've always considered myself to be fairly healthy, never any major concerns, so it was a case of why do I need to subject myself to something that isn't necessarily going to help me, because I don't appear to be ill on a regular basis. So it was offered to me again last year and I declined it as normal, the routine was there. However, unfortunately, later on in the year, I did develop what I now know to be flu. It came literally with no warning whatsoever. I thought it was going to start as a basic cold, but as time went on, it literally got to the stage where I became bedbound, which I've never actually done in the past. I was literally aching all over, my muscles were aching, to the extent that I couldn't get out of bed, literally even to go and have a shower properly, because I just felt that tired. So that went on, and I'm trying to sort of look after myself, self-manage myself, because the doctor can't do anything. There's no antibiotic cure for this. It's influenza. It's depending on your health, depends how long you're going to have this illness, and you've got to work your way through it by self-medication. Everything was going as you would expect it to be. I was feeling unwell, etc. My family came to see me, including some of my grandchildren. Unfortunately, as a consequence of that, one of my grandchildren developed what I now know to be flu as well. This was particularly upsetting because it was coming up to a Christmas period. So, all of a sudden the festive plans could be interrupted and changed here because all of a sudden one of the children's got influenza. Where else is it going to spread in the family? But nevertheless, it was quite bad, and I felt really guilty about that, especially on the basis that, in essence, I could have prevented this. I could have prevented all the suffering that I'd gone through lying in bed, aching joints, muscles and everything else, and also that one of my grandchildren had picked up the flu virus from me. As part of our role, really, in the health service, we're always caring about patients. We're always saying to patients, you should look after your own health, you should take your medication, you should do everything preventative. And here I was, rejecting the flu jab that was available to me at no cost. My message really is when they offer it this year, I'm giving them advance notification, I shall be having the flu jab, and I would encourage all colleagues to have the flu jab within the NHS. You never know, you could be in the wrong place at the wrong time. You could pick this up anywhere, from any member of the public, from another family member, and if you can help stop that spread by just taking the flu jab, it's a good message. So my message really is, take it, it's free. Use the facility that we've got.